Hey everybody, it's Pastor Steve Hickey here, and I hope you're having a great day. I've been having fun with my new flip video camera, and so just trying something out here. I'm with my very good friend Pastor Gabriel Medicine Eagle from Ideal, South Dakota, the Rosebud Reservation, and I realize I'm the pale one in the picture. He thinks I need to go out in the sun a little bit longer and get in the cooker, and we can match better. But I thought I'd talk to you today just briefly about healthcare, because that's a big issue in the United States right now, and the government-run healthcare program is really what we have out on the res, and so I want Gabe to say something about that in a minute. One of the things I'm really excited about, and I've been telling him for years that he needs to run for governor or something, but he's finally doing it. But Pastor Gabe is running for tribal council out in on Rosebud, and so without a vision the people perish. And Gabe, why are you, a pastor, running for tribal council?
The main reason is to try to get God involved in our government or in our tribe, and basically that's the main thing. But once we get God involved, then we'll see a lot of other things just begin to fall in place. One of the things is healthcare. One
of the reasons that Gabe has had such an impact is because he's brought God into his community in Ideal, and we've been reading about, and Gabe's been very involved in suicides among teenagers on the res, but they're not committing suicide in his community. Why?
The main reason our children do not attempt or commit suicide on our reservation is because from the children on up, the little kids all the way up to teenagers, have all gone through our Sunday school program, where my wife Vi has taught them that it's right, or whether it's right or wrong, or she teaches that it's wrong to commit suicide. So our children grow up knowing about Jesus, knowing the difference between right and wrong, and they know it's not a thing to do. So we don't have suicide in our community. Even though we're on the reservation, we have a little community within the reservation.
So Gabe's really bringing the life of God, and I'm excited about that. We've had a lot of fun over the years working together, and he's committed to life from the womb to the natural death, and he's been a good brother. I want him to tell you what happened to his wife Viola's sister just 2 weeks ago, her husband, and it'll give you a window into what's going on with Indian health care, so that we can understand what that means when the government takes over health care. So 2 weeks ago, your brother-in-law, Gerald, Black Bear Jr., tell me.
He got bit by a rattlesnake on the leg, and they took him probably about 7 o'clock in the evening, took him into the hospital there in Rosebud. He laid in the emergency room until about 1 o'clock in the morning. There had been 2 others that had got bit by a rattlesnake that same evening, but Gerald, after about 1 o'clock that night or that morning, well, they finally let him go. They told him to go home because nothing was happening. So they put a SPONGEBOB band aid on his wound there, and they sent him home. The next day,
wait. They couldn't get him to a Sioux Falls hospital, and they sent him to his house with a SPONGEBOB band aid.
Yeah, they sent him home. The next day, he went to Rapid City. When he got to Rapid City, the venom started causing his leg to swell and to blister, and so they took him to the hospital there in Rapid City, another IHS hospital, and they transferred him immediately to a regional hospital there, where they gave him 5 units of anti-venom to stop the venom from doing any more damage.
Yeah, and he's better today.
He's better today.
But his wife, sleep deprived, taking him to the hospital in Rapid City in the middle of the night because the care wasn't available in Rosebud, couldn't get to Sioux Falls. Sleep deprived, the doctor tells her to go home and get some rest. What happened?
They had just purchased a vehicle that following day when they got bit by a rattlesnake. That same vehicle they used when they went to Rapid City, and on her way home to get more clothing so she could go back up and spend more time with him while he was in the hospital, she falls asleep because of sleep deprivation, and then she rolls her vehicle 3 times, and she ends up in an emergency room also. No broken bones, but
with her granddaughter, and it takes the jaws of life.
Yeah, it takes the jaws of life to cut her out.
Yeah. Well, it's just a tragedy, and it's happening all the time. And I know we're about out of time, but Gabe, why is the Bureau of Indian Affairs under the Department of the Interior, and how do you feel about that?
Well, the Department of Interior is a department that's under the government that looks over all the wildlife, the Game Fish and Parks Department, or the national parks, all the wild game and all these. And so because we were considered wildlife back in the 1920s, or when they put this Department of Interior, they brought us under the Department of Interior because we were considered wildlife back then. So who knows? Maybe we should go see a vet.
Anyway, God bless you guys. Let's vote no on the Obamacare.